Hello, my name's Andrew Bellamy. I'm a registered osteopath and I want to talk to you a little bit about the type of exercises that you may need to help repair and rehabilitate following major shoulder injuries like rotator cuff tears, dislocations, surgery and so on. And they fall into two basic categories. They're the passive exercises, which you do very gently without the use of the muscles, and which may be helped by an osteopath or a physiotherapist. And the second group are the active exercises that help you to build strength, and that will come to a little bit later on. So, with the passive exercises, we're essentially trying to not use the muscles too much. We use methods like momentum, which is where the pendulum exercises come in, and we'll cover that in a moment. And also when your joints are being moved passively by somebody else, like an osteopath or a physiotherapist. But the pendulum exercise I want to do for you now is really something that you could be doing at home, and you'll be encouraged to do to increase the range of movement of the joint, and also to re-engage with the muscles that have been damaged. You need a small weight. In this case I'm just holding some ultrasound gel, and somewhere where you can comfortably lean. You want to lean forward, legs reasonably apart to give yourself some space, and allow the injured arm to hang down with the weight in the hand. And use your body to initiate a series of movements which might be circular, as I'm doing now, and if they are, do between 10 and 20 in a clockwise direction, and then stop and allow things to slow down, and then initiate, you again using the rest of your body, not your damaged shoulder, to initiate the opposite direction. Try and keep the injured shoulder as relaxed as possible, in spite of the fact I'm sure it's going to be painful. You can also change the direction by swaying and allowing the arm to go from side to side, and again you can do it by swaying backwards and forwards and initiating that movement. Now, there are times when even that gentle passive movement is just too painful, particularly in the first week or two after your injury. And I know from personal experience that this is certainly so. What I've developed for my own use is to lean forward in the same way, allow the affected shoulder to relax, and using your good arm, grab just above the elbow joint, very gently, and also to very gently initiate whichever movement you want it to be, whether it's the clockwise or the anti-clockwise. And once you've got that movement going, you can even just sort of help it along a little bit with the other arm. And for example, just a tap will swing it backwards and forwards and a movement away. Now, stay within your comfort zone. Don't make yourself hurt too much. But obviously if you're not causing any discomfort at all, that may be too little. It's a very fine margin, and you need to talk to your therapist as to just how much you can push yourself. So that's the pendulum exercise. It's the most important of the passive exercises that we tend to suggest, and at another date we'll come back and do some more active exercises. Thank you.